Interpretation of normal ECG. So a normal ECG have normal isoelectric line without any artifact. First step in ECG interpretation is to look for standardization, so check whether standardization is properly done. So standardization is the vertical marks present in ECG paper. Check whether this vertical marks cover two big square exactly. Then check whether standardization is in normal amplitude, half amplitude or in double amplitude. So heart rate is calculated by two methods. First method is heart rate equal to 1500 divided by number of small boxes between RR interval. For example, in this picture, number of small boxes between RR interval is 25. So 1500 divided by 25 is equal to 60. Then we'll see another method. So in this method heart rate is equal to 300 divided by number of large boxes between RR interval. For example, in this picture, large boxes is 5. So 300 divided by 5 is equal to 60. So heart rate here is 60. Rhythm originating from SA node is called sinus rhythm. So normal sinus rhythm is 60 to 100 beats per minute. Rhythm is classified as regular rhythm and irregular rhythm. P wave is produced by atrial depolarization. So it is upright in most leads except A versus R, V1. Amplitude or height of the P wave should be less than 0.25 mV or 2.5 mm. And then duration of P wave should be less than 0.12 seconds. PR interval is the beginning of P wave to beginning of QRS complex. So normal PR interval is between 0.12 to 0.20 seconds. So PR interval is constant, that is not more than 3 to 5 small boxes. QRS complex is produced by ventricular depolarization, and normal QRS complex duration is 0.04 to 0.12 seconds, that is not more than 4 small box. In the second picture look at the lead V1, there is small R wave and big S wave. Gradually R wave increases and S wave decrease in amplitude. ST segment is usually isoelectric, but may be slightly depressed, that is 0.5 mm, or elevated, that is 0.2 mm, in precordial leads. So T wave is upright in most leads, except AVR, lead 3, and V1, and it does not exceed 5 mm in height in limb leads, and 10 mm in precordial leads. U wave is smaller than T wave, and it is difficult to notice, but well appreciated in precordial leads, that is V2 to V4. So U wave is easily visible when QT interval is short. It is also easily visible when heart rate is slow. QT interval is measured from the beginning of Q wave to the termination of T wave. So QT interval, it varies with heart rate. So for proper interpretation, QT interval is corrected for heart rate. Corrected QT interval is known as QTC interval, and it is determined by Bazzett's formula, that is QTC interval is equal to QT divided by square root of RR interval. Normal QT interval ranges from 0.35 to 0.43 seconds.